What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering X-ray tech versus respiratory tech. So to give you context, I am an X-ray tech. I do night shift, 7 on, 7 off, and I work a lot of day shifts, so I dabble in the overtime. So, the infamous RT versus the RTT. So essentially what we do, X-rays, we take images, and respiratory deals with lungs, everything to deal with lungs. We do kind of co-meet and join forces, because when we take chest X-rays, sometimes the respiratory tech looks at ours and can kind of determine, oh, most likely they're going to have to intubate. Oh, they have pneumonia. We'll have to do this, do that for breathing treatment or for whatever they got to do. So we kind of intertwine together, even more than nurses, I would say, because they kind of understand what we're going through. And usually where they are, we kind of follow, or wherever the X-ray tech is, they will soon to follow. We're always kind of back and forth together type of situation. But as far as key differences, respiratory techs do, before COVID, it was just simply, it was a pretty easy gig. It was just mainly breathing treatments, and if they had to intubate, or if they had to check on their blood work, if they had to do check their, sometimes they draw blood to see what their O2s and stuff is, bicarbonate and stuff like that. Usually it was a pretty good gig before COVID, and then COVID hit, and then everyone needed a chest X-ray, everyone needed breathing and stuff. So a lot of the times what happens is we'll have respiratory come in. So let's say someone can't breathe, the ER. Someone can't breathe. Usually what will happen, we will take a chest X-ray. The respiratory, you will either look at it, or the doctor will be there and be like, okay, we're going to need this, this, and that. Sometimes a simple breathing treatment, they just put their little mask on, put their little juice, and they breathe. Other times, if the X-ray looks bad, if they're doing real bad, they'll kind of do a little BiPAP. So they'll have the breathing machine that forces air down. They'll go that route. They'll kind of deal with that. And then intubation, depending on what floors, either the respiratory person will help assist the doctor with it, or the doctor will do it by itself. And then if any adjustment will have to be done to the tube and stuff like that, then the respiratory tech will come in. There's that situation. Sometimes for bicarbonate, they'll you'll see them drawing blood, so they have to do drawing of the actual blood and stuff like that. They have to go around. Once again, they do a lot of rounds. If they are on the floor, usually they'll have 2 in the ER, and then 1 on each floor. And then there'll be one that is the supervisor or the lead that will kind of will either show up to all the traumas, or will kind of bounce around whoever needs help type stuff. I would say they probably make a little bit more money than we do, just simply because of all the hands-on stuff they do. It is it is quite stressful, I would say, because we as X-ray techs, if they need a chest X-ray, literally 30 seconds. Usually it's just a one view, 30 seconds in and out will be done. Respiratory, constantly got to be monitoring the patients, be watching the for if they're statting, if their oxygen, simple stuff like that. If seeing what level their blood work, or how to see if they need to increase or decrease their oxygen for the patients. It gets they do a lot. I've seen them go around. They get busy a lot. So there's that side. I would say, especially now during the winter season, us as X-ray techs and the respiratory people, we will start doing a lot more work because of the flu seasons that come. So that's kind of insight of the difference. I mean, X-ray, once again, if you're watching this on the channel of the X-ray, like, you know, we just mainly do X-rays, chest X-rays, and all the extremities and other spines and stuff like that. It's just the imaging versus respiratory, which deals with mainly your lungs, your blood work, and all the stuff like that. Yes, it's been your Miguel. See you on the next one.